All right. Welcome everyone to our February webinar. We're really excited. We have two presentations today. We have a group presenting on the SPICE model. They're going to kick us off, and then we will have Dr. Ochoa on a little bit later just to share about some clinic safety updates, especially for your immigrant patients and what you need to know with that. And then we will end with just a couple of quick chapter updates. So with that, I will hand it over to Tiffany and team to kick us off and share a little bit about the SPICE model.
Yeah, thank you guys, everyone, for joining and for letting us come and talk. There's four of us going to speak today. I'm Tiffany Leopard. I'm a genetic counselor that works for Partners for Inclusive Communities. Natalie Welcher is a speech language pathologist. Leslie Whitefield's an APRN. And then we have Dr. Little as well that are going to talk a little bit about the SPICE model. So I'll let Natalie go ahead and start.
Thanks, Tiffany. Hi, everyone. I'm so honored to present to y'all today and share a little bit about our passion and our project. So, like Tiffany said, we are working with DHS, as we are the University of Arkansas Partners Group. So this is a grant that was awarded to us in order to look at stabilization and supports for families. And part of that is accurate diagnosis. And so, as providers, whether you're in whatever role, you know that there's a diagnostic problem in our state pertaining to wait lists that are a year to 2 years long for any specialized evaluations, diagnostic services that aren't easily accessible for families. Whether they have to drive to Little Rock or they have to drive to Springdale, it's not just easy access to someone that lives in Warren, Arkansas, or maybe Hazen, Arkansas, or something like that. And so there is also the aspect of the critical needs population. So individuals with any kind of disorder or individuals that are in the foster care system, any type of population that is having to navigate these problems in our state, they're not getting these diagnostic services or they're not knowing where to go for diagnostic services. So we recognized and DHS recognized that these are the three main problems that kids and families face on a daily basis, especially in these important early intervention years of, okay, we know something's going on, and even our medical provider has told us we know something's going on, but we don't know what to do next, or it's going to take us a long time to figure out what to do next. So we are hoping to give a solution to this problem, and that's what we've been working on this year. So our solution has a easy to remember name, and it is the SPICE model. Overall is kind of like the whole structure of this. We are the SPICE state level team, so we call ourselves the SPICE Girls since it's three awesome women. But SPICE actually stands for the Statewide Practice of Interdisciplinary Clinical Evaluation. So we are wanting to take this diagnostic model, spread it across the state of Arkansas, make it statewide, and make it an interdisciplinary. So we're going to talk about that in just a little bit, but professionals working together in order to make these clinical evaluations worth the while of the family and the child so that they're getting a good picture and it's a child and a family approach. So we have established diagnostic teams that we are calling SPICE teams across the state, and we'll show you kind of the logistics of that later on. But that was the model was, okay, we're seeing these three problems. We need to expand these diagnostic practices, put them in these people's backyards, and we need to get professionals to collaborate together so it's all hands on deck. And it's not just, okay, go here and now you're going to go see this person. And then in 3 months, you're going to go see this person. Everything's kind of taken care of in a one-stop shop. So as I mentioned, our model is designed to improve identification, the evaluation, and then services and resources for families, and specifically the child or the client. So we are wanting to empower, train, educate, mentor, all the things for providers in Arkansas communities across the state in order to identify, okay, this kid on my caseload, is this a child that would benefit from a neurodevelopmental disorder evaluation? Yes or no? So I'm going to identify first. Then I'm going to move on with this evaluation. I'm going to get my team members involved, and then I'm going to bring the family in and we are going to conduct this evaluation. After that, I'm not just going to say, okay, we all made a decision. Your child meets criteria for this diagnosis. Now have fun on Google. We are going to provide those next steps to help the family and help whatever else in their community needs to be plugged in for appropriate services that are evidence-based for these diagnoses and for resources that's going to help the child in whatever setting that they're in or for other providers that are involved in the child's life. So it's identification, evaluation, and then those next steps, giving those services and resources that are evidence-based that will help the child and the family as a whole.
Okay, so in our SPICE model, an interdisciplinary team is formed, and teams are comprised of an allied health professional, so a speech language pathologist or a Psych D, and then a medical professional. So that can be an MD or an APRN. And we already have many clinics, and you're going to see that a little bit later in our presentation, that we have established throughout the state, trained, have up and running, and we're still in the process of training more. And those teams are comprised of some with MDs, some with APRNs, and we'll get a little more specific about that here in just a little bit. But that's all it takes to give that diagnosis. So even a primary care provider is able to diagnose a neurodevelopmental disorder. And so that's what we're doing, because these primary care providers know these children well. They're not just seeing them that one time. And so it's the best way to get that good, accurate diagnosis and to get that child services within their community. So this is kind of what our teams look like. And we do have a little bit of each of these. So the first top picture is community partners. So you've got a local allied health professional joins a medical professional at their clinic to conduct these evaluations. So Tiffany, Natalie, and I have a clinic in Little Rock, and we are all three usually together. Two of us may be in person, one may be virtual, but we're always together in the same room, evaluating this child so that we can get the full picture. And several of the teams that we've set up throughout the state look just like this. They've been able, the medical provider has been able to either have a speech language pathologist on staff at their clinic, or they have one in the community that will come to their clinic and work with them. The second picture, well, that's the in-house team we talked about. That they have one in-house. So like Dr. Little's team, they have a speech language pathologist there in-house. So it works out great, and they are rocking and rolling, seeing these children and doing such a fabulous job. And you'll get to hear from her in a little bit about what they're doing in Harrison. And then example 3 is the special referral system. So we do have a couple of teams. We have one in Paragould that they go to see the primary care provider. She refers them to the speech language pathologist. They do the testing. They write their part of the report. She sees the kid in clinic. They collaborate together and talk and come up with the diagnosis or not diagnosis if the kid doesn't meet criteria for the different neurodevelopmental disorders that we assess for. And so all 3 of these are great ways to do this and have all worked really well. It just is kind of whatever works better for that provider, that speech language pathologist in their community. So our training is pretty in depth. We developed 5 modules. Module 1 is really just kind of going over the model, getting the providers very familiar with the model, what it looks like, all of that. Module 2 is a really deep dive into fetal alcohol spectrum disorders because it is a spectrum. There's a lot of different variables. So we want them to be really comfortable. They've got a lot more education on autism, ADHD, some of the other neurodevelopmental disorders, but fetal alcohol spectrum disorders in curriculum throughout the years has not been as strong. And as research develops, and we have found that it's so much more common than what we once thought when it was just they had to have the facial features. And so we're really wanting to educate so that that can be really understood because it is a crisis. So many children have this that have not been identified. Module 3 is kind of a deeper dive into all the different neurodevelopmental disorders and getting into that differential diagnosis. And so then in Module 4 is diagnostic practices. In this module, we actually go to the clinic or Zoom into the clinic. We go over all the different ways the clinic could look. We go over all the testing materials because we want our medical providers to be familiar with those testing materials too. Even though the speech language pathologist is doing a lot of that testing, it's really important that we know that material as well, what we're testing for. A lot of times we can hand those out in those clinic visits before they go see the speech language pathologist because this does take quite a bit of time for these parents to fill out the paperwork. So we like to have that ahead of time as well. We also do some case studies and things like that with the providers to get them to make sure that they're comfortable and they're ready to start seeing those kids. And then module 5 is the mentorship. And this one is such an important piece of it. We provide mentorship, whether it be a complex case where they're like, I saw this kid, they were really complex. It could be something genetic. That's where Tiffany is invaluable. She's, I believe, the only genetic counselor on one of these teams in the country. And so we're very fortunate to have her on our team where she can help us with that genetic piece to rule that out so that we can get to that diagnosis. And then these teams are able to send us their reports, especially those first several reports that they're writing on these disorders so that we can kind of help guide them through that process, fine tune the reports before they go out to families. They can pick up the phone and call us. They can email us at any time to walk with them through any piece of the diagnostic process. So we also provide them reference guides. We have done tons of research and found resources in all these different communities and provided those to them for therapies, for mental health, all different kinds of resources. We also provide them with FASD resources, all different things that are very helpful for these children. So some of the neurodevelopmental disorders that we look at, so we look at neurodevelopmental disorder associated with prenatal alcohol exposure, and there's pretty strict criteria for this. A lot of the testing we do looks at this. Does the child already have a diagnosis of ADHD? Things like that are all part of the criteria. Were they exposed? Do we have confirmed exposure to prenatal alcohol exposure? A lot of times we may not, and that's where we jump down to the unspecified. Very likely they were, but we don't have that confirmation. We can diagnose if they meet all the criteria, the unspecified, and they can get those same services that they could get with the NDPAE. And then the neurodevelopmental disorder associated with prenatal substance exposure, that is if they were exposed to anything other than alcohol in utero, such as drugs, things like that, and then autism spectrum disorder. And we're going to talk about that a little bit more on the next slide. So just like all the other developmental disorders, such as the FASDs, a diagnosis requires evaluation by 2 of the following clinicians. So a physician or MD, psychologist with doctoral degree, and then also a speech language pathologist. Now, I do want to highlight that that APRNs can help with this process. So they can see this child in clinic. They can write the reports with their attestation that they feel like this child, based on all the testing, based on all the strict criteria, meets the criteria for autism, and their primary care doctor can sign off on that. And so you may be getting reports from some clinics. Most of our clinics have an MD in-house. There's a couple that don't, but you could potentially be getting a report asking you to sign off. Just know that these people have been very well trained. They're not just out there writing autism diagnosis on any child. It's very, very carefully done. And so you can go through the report and the testing and sign off on that for that child so that they can get those services. And they must have an autism specific measure that's completed on that child, whether it be the ADOS, the CARS. We are training on the CARS. There are several of our providers we've trained that were already ADOS trained and prefer to stick with the ADOS. But going forward on most of these clinics that have not been trained on either measure, we are using the CARS for this training.
Okay, so say we're training people around the states like hunky-dory and everything, but what does that look like? What is the actual impact of this SPICE program? So to give you a bit of an idea of where these teams are, here's a great map that shows them. So if there's a red star, it shows clinics where training has either been completely finished and they're about to start evaluations, or they're already conducting these neurodevelopmental disorder evaluations. Teams that are, or the stars that are in yellow are ones that clinical teams have already signed up and they're in the training process. So hopefully we can move them through pretty quickly and they'll start conducting evaluations. But you can see like our goal is to provide coverage throughout the state. We don't want people in Arkansas to be in the situation where they have to drive 3 hours to be able to get diagnostic services. And so I think we're doing a pretty good job of starting to cover the state right now. Right now we have 11 teams that have completely finished the training process and are conducting evaluations or will start, and we have 4 that are in progress right now. Of the clinicians, we've trained 69 clinicians to conduct these evaluations, and we have 7 more that are somewhere in the training process of those 5 modules that Leslie was talking about. So kind of what does it look like? What's the breakdown? I went through and I counted some of the clinics that are conducting evaluations, as well as the clinic in Central Arkansas that Natalie, Leslie, and I do. And we've actually diagnosed or evaluated at least 96 children so far. You can see the one that gets the most diagnosis so far is NDPAE, the neurodevelopmental disorder associated with prenatal alcohol exposure. The second largest one is the unspecified, and that's the one, like Leslie said, where they have signs and symptoms of a neurodevelopmental disorder, but they don't necessarily have a known cause for it. Like we don't know for sure that there was alcohol exposure in pregnancy. I think the one that a lot of us are really excited about is the autism diagnosis. So 11 people were able to get the autism diagnosis at one of these clinics. To kind of break it down a little bit further by clinics. So the Partners Clinic is the one that Leslie, Natalie, and I run here in Central Arkansas. We have seen 53 patients. I think that, I mean, I like to think it's impressive, of course, because I'm doing the clinic, right? But we have been doing this less than a year. So to give you an idea of kind of where we're at. So, you know, we developed the modules, training, doing evaluations in the meantime. And so I think 53 is a number that like we're really very proud of. The other teams that I put in here, the 5 other teams, haven't conducted as many, but they have not been around as long as we have. And so some of them are really just starting. The Conway Clinic did 13. One of the teams in Paragould, we actually have 2, but one of them's conducted 6. A team in Helena's conducted 2. A clinic in El Dorado's doing great. They hit the ground running and have done 12. And then the Harrison Clinic so far has done 10. And so you can see the different diagnosis at those different clinics. But it's really kind of all over the place. We don't have any clinics that are just diagnosing FASD or just diagnosing autism. They're really, truly looking at people holistically and doing a really thorough evaluation to make sure that kids get the appropriate diagnosis that they need. So I've had a wonderful experience being a clinician at the Partners Clinic, but I've had an even more amazing experience talking to other clinicians and helping them get set up to do this process. And so I want to turn this over to Dr. Jessie Little, who has been amazing to work with, and she's at the North Arkansas Regional Medical Center in Harrison. And I just love for her to share her experience on how the models work for her and the process and the evaluations and everything like that.
Well, thank you guys. I appreciate you asking me to join this meeting. It has been a wild ride. It's been really fun. A little bit about myself. So I grew up in Texas, but came over to Arkansas for undergrad. I went to UAMS for medical school and recently graduated from Arkansas Children's Hospital in my pediatric residency. So I started at NARMC just in August. And soon after I got here, the hospital administration and the APRN that works in the pediatric clinic, we all had a meeting and they said, hey, we have this need. And we started talking about the autism diagnosing and how long the wait lists were and things that I knew. But now that I moved from Central Arkansas to North Arkansas, much more rural, the commute for all my patients is significantly longer. It was a much bigger deal to my patients. And so we talked and we talked, and I said, to me, the diagnosis of autism is way more than a diagnosis. We have to walk with these patients and not only diagnose them, but we have to help them on the back end. We have to be able to provide support and resources and know what the next steps are so we can help these families navigate that. And at the time, I said, I don't feel like we have that in place, so I would not feel comfortable diagnosing. And it wasn't a week later that someone from the Spice Clinic reached out and we set up a meeting, and they went through their model and they said, hey, we're going to provide those resources. We're going to provide that support on the back end, and we're going to train on the front end and make sure you feel comfortable. And we decided to go ahead. So it has been really, really neat. I have loved working with this group. They're very responsive to everything. Like they said, we started evaluating patients in Harrison in December, and we're currently doing it like one afternoon a week with plans to try and pick up the pace and do more as we get more patients that need evaluations. And it is incredible to see patients that I talk to families who have concerns about their child, and many of you know the anxiety that comes with just worried that your kid has a neurodevelopmental disorder, has autism, and um, when you're forced to wait months and months and months for an answer, that's really hard on families. So when we can say, hey, let's get you into our clinic here, fill out the packet, get those forms to us, we'll get you on the schedule within a month or two. That is super valuable. And the kids that we have diagnosed, being able to follow up with them and say, hey, we recommend these therapies, let's get you into this. And then I get to be the one that sees them at their well check, see how things are going. It's been incredibly rewarding, incredibly rewarding. The community has been so excited. We recently got to go to a meeting with the local co-op that does all the special education for our surrounding community, and share with them what we were doing with the Spice Clinic. We have figured out a way to go beyond the grant and do more than our 15 evaluations, which we're really excited. So we can now accept outside referrals in the surrounding areas, so different providers in town, outside of town, so that we can do full evaluations on their kiddos that need it as well. So being able to work with the schools and the people in the community and having that open conversation with the people that are going to be putting our recommendations in practice is amazing. It's so good. I had, what was it, last week, I reached out to an ABA therapy group in the area and was able to talk to them about what resources we could offer our kids and who all they covered. And they were excited to get started as well. So I think one thing you guys had already touched on that I just want to share as well, we went into this thinking, autism was what we really wanted to be able to focus on and talk about. And you guys have kind of opened up our minds to all the other possible neurodevelopmental diagnoses. And you could see from our bar graph, we've done a couple autism diagnoses, but we've also done some NDPAE and PSE. And that's just been surprising. Just knowing that, okay, if the diagnoses are surprising us after the evaluation, that makes me feel like we're doing it correctly.